Welcome back to Living Through the Pause. I'm Dr. Butler, your favorite exercise scientist, and this is a space where we talk about all things women's health, strength, and thriving through every season of life. Frozen shoulder is one of those conditions that sneak up on people slowly, quietly, and then suddenly feels like your shoulder has been locked inside a vice. In this episode, we're breaking down what frozen shoulder really is, why it happens, why it's so common in midlife women, and what you can actually do about it. As always, we're cutting through the confusion with science, clarity, and compassion. Whether you're dealing with frozen shoulder right now, supporting someone who is, or simply trying to understand your body better, this conversation will give you the knowledge and the confidence to navigate the healing process with intention. Frozen shoulder, clinically known as adhesive capsulitis, is a condition characterized by stiffness, severe pain, and limited range of motion in the shoulder joint. It occurs when the connective tissue surrounding the shoulder joint, called the shoulder capsulitis, becomes inflamed, thickened, and tightens. It forms bands of scar tissue, which are the adhesions. Over time, symptoms will get better. It typically takes 1 to 3 years. Now, you may be wondering, how does it differ from rotator cuff injuries, arthritis, and impingement? Even though these shoulder issues can feel similar, each one affects completely different part of the shoulder. And that's exactly why they behave so differently in the body. For a rotator cuff injury, if you try to raise your arm on your own, you can't due to torn muscles or tendons. But if an examiner lifts your relaxed arm for you, they can move it pretty much through a full range of motion without limitations. With frozen shoulder, the joint capsule itself is physically tight. Neither you nor the examiner can force the arm past the restriction point without severe resistance and pain. For shoulder arthritis, it is a true hard tissue block. As the smooth cartilage wears down, the joints start moving bone against bone, creating friction, bone spurs, and an unmistakable grinding sensation. It's one of the few shoulder conditions that actually shows up on a standard x-ray. With frozen shoulder, it's a soft tissue capsule contraction. X-rays appear normal. With shoulder impingement, the soft tissue gets pinched when the arm moves in a very specific overhead window. This is the classic pain arc. Outside of that zone, most people can move their shoulder just fine. However, frozen shoulder affects movement in all planes, especially the external rotation that's turning the arm outwards, or the internal rotation that's like reaching behind your lower back. When we hear the term frozen, it makes it sound like the shoulder suddenly locks up, but that's not how this condition works. The stiffness builds slowly as the capsule thickens and tightens over time. The name is misleading, but it's memorable, and it does capture the end result: a shoulder that feels stuck, restricted, and frustrating, uncooperative. Frozen shoulder moves through 3 distinct but often overlapping phases, and each one feels different in the body. The overall timeline is highly individual, ranging anywhere from a year to as long as 3 years, depending on the person and what's driving the inflammation. Phase 1, which is the freezing phase, which typically lasts 2 to 9 months. During this phase, any movement of the shoulder causes pain, and the ability to move the shoulder becomes limited. Sleeping on the affected side becomes extremely uncomfortable. The second phase, which is the frozen phase, which typically lasts 4 to 12 months. In this phase, pain is lessened. Your shoulder remains stiff though. This makes it more difficult to complete daily tasks and activities such as reaching overhead, fastening a seatbelt, combing your hair. As a result of the shoulder not being used the way it should be, the deltoids and the rotator cuff muscles can shrink and become weak simply from not using it. The last phase is the thawing phase, which typically lasts 6 to 24 months. Your ability to move the shoulder begins to improve, pain decreases, range of motion increases, and you'll begin to have functional strength in that shoulder again. Frozen shoulder affects about 2 to 5% of the population. While anyone can develop frozen shoulder, the research is clear. Certain groups can carry a much higher risk, and the biological pathways behind it are well mapped out, explaining exactly why this condition appears and when it does. It's overwhelmingly diagnosed in adults between the ages of 40 and 60, with a peak commonness around the age of 55. It is extremely rare to see this in teenagers or young adults. Research shows that 60% of frozen shoulder cases are in women. Now, there are some conditions that can increase a person's risk of developing frozen shoulder, such as diabetes, type 1 and type 2. In fact, it has been noted that diabetes is the single strongest clinical risk factor of developing it. People who suffer from diabetes have a 10 to 20% lifetime risk of developing frozen shoulder, which is actually 5 times higher than non-diabetic people. They also experience a more prolonged symptoms and higher rates of bilateral involvement, meaning it affects both shoulders. Next is thyroid disorders. People who suffer from thyroid disorders tend to have a higher rate of inflammation, which increases the risk of developing frozen shoulder. Next, people who suffer from high cholesterol or vascular diseases have an elevated risk of developing frozen shoulder. Lastly, hormonal shifts can elevate one's risk. Women between the ages of 40 and 65 experience frozen shoulder at a significantly higher rate. Estrogen decline weakens the anti-inflammatory and anti-fibrotic defenses, making the capsule more vulnerable to thickening and tightening. Then, because estrogen influences collagen turnover, the connective tissue elasticity and inflammation signaling. So when it drops, the collagen becomes disorganized and prone to fibrosis. Frozen shoulder has a very recognizable symptom pattern. These signs help distinguish adhesive capsulitis from rotator cuff injuries, arthritis, impingement, and they appear consistently across all clinical research. First, there is a deep, aching shoulder pain. It's a slow-building, constant, deep ache in the shoulder joint, which is often worsens with movement. Next, you'll experience progressive stiffness in all directions, meaning every direction of movement becomes restricted. This is often referred to as the hallmark symptom. Then you lose range of motion. You can't move your shoulder, and no one else can do it for you either. This is what separates frozen shoulder from rotator cuff injuries. Your sleep is disturbed because the pain often intensifies at night, especially if you're lying on the affected side. Frozen shoulder makes everyday movement difficult, such as reaching overhead, fastening a seatbelt, reaching behind your back, or putting a jacket on. Lastly, frozen shoulder symptoms does not happen suddenly. They build slowly over weeks to months. Okay, so I have discussed what frozen shoulder is, who is most likely to suffer from it, and its symptoms. And I know you're asking, Dr. Butler, how can we treat it and feel better? And I'm so glad you asked. When treating frozen shoulder, regardless of the phase, the goal is always the same. Reduce pain, restore mobility, and prevent long-term stiffness. Over 90% of cases are resolved with non-operative care, such as physical therapy, which is actually considered the cornerstone of treatment. Gentle mobility work is the foundation of recovery. Early phases focuses on pain-free stretching. Later phases introduces strengthening. Physical therapy helps loosen the tightened capsule, gradually restores mobility, and prevents long-term stiffness and builds shoulder stability. The next option is a non-steroid anti-inflammatory drug such as ibuprofen or Tylenol. Healthcare providers may offer cortisol injections into the joint, which reduces inflammation and pain, especially in the early freezing stages. Heat therapy is also an option. Heat improves blood flow and reduces pain, making stretching more effective. When physical therapy or oral medications aren't enough to move the needle either on pain or mobility, there are minimally invasive and surgical interventions available, so the shoulder can start to progress again. For example, hydrodilation is a procedure which sterile fluid is injected into the joint capsule to stretch it from the inside. Research shows that acupuncture improves pain and mobility when combined with physical therapy. In severe cases, manipulation under anesthesia is an option. This procedure, the shoulder capsule is stretched while you're asleep to break the adhesions, which can lead to rapid mobility gains. This procedure is fast, but it carries minor risk of soft tissue tear and bone injury. The last option I like to share is a surgery called arthroscopic capsule release. In this procedure, a surgeon uses a small pencil-sized instrument to cut or release tight, scarred sections of the joint capsule. Frozen shoulder responds best to a combination of gentle mobility work, pain management, and targeted interventions such as cortisol injections or hydrodilation. Most people recover without surgery, but the process takes time, and matching the treatment to the condition stages is key. My hope is that you're walking away with clarity, confidence, and a real understanding of what's happening inside your body, and not fear, not confusion, but knowledge that you can actually use. Frozen shoulder is frustrating. It's slow, and it can feel like your shoulder has betrayed you. But it's absolutely treatable, and you're not powerless in this process. Remember, healing takes time, but it takes time with intention, gentle movement, the right intervention at the right stage, and a whole lot of patience to carry you through. If you're navigating this right now, give yourself grace. If you're supporting someone else who has this, share this with them and let them know that they're not alone. Thank you for spending part of your day with me here on Living Through the Pause. If this episode helped you, inspired you, or taught you something new, make sure you subscribe and leave a review, and share it with another woman who deserves to thrive through every season of life. If you want to stay connected with me, learn more, or work directly with me, you'll find me across all platforms at Newsom Fitness. My website is www.newsomfitness. Facebook is Newsom Fitness. Instagram, LinkedIn, I'm also on there as Dr. Butler. Reach out, join the community, and keep learning with me. We're in this together, thriving, evolving, and rising through every pause. Don't forget about my Menopause Awareness Resource Fair on October 3rd at Chicken and Pickle. Registration is open for attendees, sponsors, and vendors, and I would love your support. I will see you in the next episode. Until then, keep moving, keep learning, and keep living through every pause.